Croesawu pawb I briefio Eno. Welcome everyone to tonight's briefing. Before we begin, I'd like to provide a brief technical introduction. Now, we're using Microsoft Teams and Facebook Live today. Microsoft Teams also offers you the opportunity to see live subtitles of today's briefing. So you should see a button in your settings to switch those subtitles on. And subtitles for today's meeting are available in Cymraeg and English, as well as Filipino, Polish, Ukrainian and Urdu. And Teams and Facebook both allow you the opportunity to raise questions. So if you've joined via Teams, on your screen you should see a tab with a question mark on it. This will normally be in the top right of your screen. And if you click on this, it gives you the opportunity to ask questions. And if you're watching via Facebook, then you can use Facebook to add your questions or comments. We'll do our best to answer those questions during tonight's briefing, but please accept our apologies that we may not be able to answer all of the questions raised during today's meeting, but we will continue to update our website with all of the latest information. Today's meeting is also being recorded. Now, don't worry, this doesn't share information about you in the audience, just the information you see broadcast on the screen today. And that also means that people who can't join us right now will still be able to watch at a later date. So thank you so much for joining, and our briefing will now begin. Welcome, Carol.
Good afternoon, good evening to you all, and thank you so much for joining our latest public briefing. We're going to cover a couple of really key things this evening, so I hope it's both enjoyable and informative. And we're going to really start with a focus on the winter. It's particularly important given that A, the clocks have gone back, and B, it does certainly feel wintry, and I think we've been spoilt by the autumn weather. Now as we move through, it is certainly starting to get colder and more blustery. There are many things that you can do, though, to help to prepare for winter, and we felt that it was probably a great opportunity for us to share some of that with you. And for those members of the public communities who have engaged with us over all of these public briefings, you will have followed us through the pandemic and through the vaccination programme, etc. So we know how being active in our own health and care makes a big difference. I'm going to hand over shortly to Adrian Osborne, who you heard from just as we got the briefing underway, and then I'm going to come back and brief a little bit more on some new members of the Health Board, and I'm going to be introducing our new chair to you, cover off some of the Health and Care Academy work that we've been doing and share some of that again with you, and then ask for some of your contributions, if you would, to our thinking about the future. I'm going to touch a little bit on the outlook that we have ahead, quite challenging to probably say the least, but in the spirit of our conversation previously, that's what we'll aim to do. So if I can hand over to you, Adrian, and you're going to give us a bit of a how we can keep well, be prepared for winter.
Thank you very much, Carol. And if we can have the next slide, please. As you said, clearly it's going to be a challenging winter ahead. COVID and flu are already circulating, and we've got the additional challenges of the pressures on the health and care system and the economic climate affecting us all. And I know you want to come on to that a little bit later with some more detail, Carol. So as part of our response to these challenges as a health board, we've been working with the County Council and other partners to develop digital information hubs on our website as a single source of information to help everybody stay well. Now, clearly we recognise that not everybody has access to the web, but hopefully by providing clear and up-to-date information through our digital and social channels, that will help all of our staff as well as the general public and local partner organisations share this information with everybody across POIS. So firstly, we've created a Keep POIS Safe hub on our website, and that contains all the latest information about flu and COVID. Because clearly vaccination is our best defence against winter respiratory viruses that are circulating right now. And so please do take up your invitation when it's offered to you. Flu and COVID are available from clinics across the county, and in fact, if you're 65 plus now, you can drop into our main vaccination clinics in Bronllys and Newtown and Llandrindod Wells for a COVID vaccine. There's information on our website about how to do that. And if you're 50 plus, you can join our reserve list as well, so that we can call you up at short notice if an appointment becomes available. And everybody over 50 plus for COVID should receive your invitation letter soon if you haven't done so already. So please do look out for that, as vaccination truly is going to be one of the best ways to protect your health and those around you during this winter. Next slide, please. So the next hub that we've created, working in partnership with Powys County Council, is on cost of living, because clearly, again, we know that this is going to be a challenging area and cost of living issues are going to be at the forefront of many people's minds. So working in partnership, we've created a space on our website with lots of the latest information about support, benefits, grants and other help available. The council have been working on warm spaces to enable people to access both information but also a warm place to meet, particularly if they're having challenges in heating their own home. So if you go to our website, we've got the web address there, you'll be able to find lots of information and a link through to that County Council hub as well. And later this month, we're expecting a new big campaign from Welsh Government on Here to Help. And that campaign again will highlight how people can access the benefits and the support that they're eligible to receive to help them through the challenges of the winter to come. Next slide, please. And then our third hub is Help Us, Help You. And this is about the idea that better health starts with all of us. It's about helping us find the right care in the right place first time. So from pharmacists to minor injuries units, from mental health helplines to online consultation, there are lots of different ways to access the NHS in Wales. So through this hub, it's about helping people to get care, help and advice with new or existing conditions, even without leaving your home or your workplace. So if you go to Help Us, Help You on our website, there's lots of really useful information available there for you. If you could move to the next slide. These explain some of the information that's available on our Help Us, Help You hub. So one example is wellbeing support, because again, during the winter and with the challenges that people are facing, then our mental and emotional health will clearly be an area where we may benefit from some help or support, or in fact experience acute crisis. We've worked with a partner organisation, Silver Cloud, to enable free online cognitive behavioural therapy courses that focus on issues like anxiety and depression, as well as money worries. And that's available free to anybody living in Wales and anybody registered with a Welsh GP. The Call Mental Health Helpline is Wales's special confidential listening and emotional support line, and it's open 24/7. And you can call free phone 0800 132 737 or text help to 81066 in order to access mental health support any time of the day or night. Mental health and money advice provides clear and practical advice to support people who are experiencing issues with mental health and money. The web address is there, but again, you can access that through our hub site on Help Us Help You. And then Mind Cymru clearly offer a really important service through the third sector, providing lots of mental health and emotional help and support. Next slide, please. And as well as mental health and well-being, clearly all of us may issues affected our physical health over the winter as well. So the Common Ailment Service is a great way to get help for 27 common conditions, and that's a free consultation and free treatment at a local pharmacy for things that maybe otherwise you might need prescribed by your GP. So pharmacies right across the country provide this common ailment service. Again, lots of useful information on our website to explain what's being offered. And if you're not sure which service to use, then NHS 111 Wales is our single point of contact to help you find the right treatment. There's an online symptom checker at 111.wales.nhs.uk, and on their website you can also find useful service directories about minor injury units, about GP services, pharmacy services, and all of the services available to you from opticians as well. And ideally, if you can access that service online, that's great, but recognise that the web might not be the ideal solution for everybody. So they also have a 24-hour telephone helpline by dialing 111, and that's free from your mobile or from your landline. So there's lots of useful information available to you on Help Us Help You, cost of living, and also Keep Wales Safe on our website. And if you just go to our website, you can access all of those hubs from the home page. And hopefully that provides useful top tips to enable people to stay well this winter. So thinking further about those challenges ahead for the winter, I'll hand back to Carol now to explain some of the ways that we as a health service are planning for the months ahead. Thank you.
Diolch, Adrian. Thank you so much for taking us through that. I think there's an array of information and guidance that's available there, and I hope it's going to be really helpful to people. And we'd love to hear the feedback. It is a particularly challenging time, and I was travelling yesterday and thought, do I listen to the news or do I listen to something else as I drove the journey that I was making? And sometimes when we listen to such challenging information a lot, we can feel that there's a bit of a sort of a gloom loop is what I've heard people talk about. So thank you for flagging in particular those emotional and mental health services that are available, and in particular Silver Cloud. But planning ahead is key, and I was working out the other day that we've got about 8 weeks, maybe less now, of this year left, and we'll be into 2023. And 2022 has been a very difficult year. We'll see how 2023 comes along. But in the health board, we are starting to plan for the next couple of years. It's been a quite challenging environment in which to plan when we're coming out of the pandemic. And I don't think whilst any of us really thought we'd ever be in a pandemic, we're coming out and facing a number of significant challenges, not least the issues of cost of living and the economic situation in the country. And as a public sector, we're starting to work on the assumption that we're likely to have less money available to spend on health and well-being next year than perhaps we have had over the last few years. Now, I don't know whether that is going to truly be the case, but when I do listen to the news and get a sense of where the budget might end up, I have to be realistic in terms of the amount of money that can be allocated to us here in the Health Board. I want to assure you that we will be working very hard to enable the money that we have to be allocated and spent in the very best way. But I'm also wanting to be open and honest with people that it's going to be a very challenging time ahead, and we may need to do things differently to the way in which we've done them in the past. And there are a number of areas that are particularly challenged at the moment. And we've got some significant workforce difficulties in terms of the pool not being big enough. And that's a challenge, as well as a challenge of money, but also challenges around access to community and social care that help people stay at home. But what I have learned in the face of all of the challenges is that colleagues across the health and care services in Powys, as well as third and voluntary sector organisations and communities themselves, can really rally together and deliver something extraordinary. So I am hopeful always that our collective efforts will mean we get through the difficult times, and better times will come, and we're absolutely assured of that. But we really do need to work together over the next few weeks, months and years on the issues that lie ahead. If I can thank people as well, because we know as a health service that a lot of people are waiting a long time for their outpatients appointment or their treatment, and a lot of people are also waiting a long time for an ambulance when they phone or to get into the emergency department. It can be hugely frustrating. I think the population of Powys and Wales are extremely tolerant and understanding of the difficulties there are, but I would like to apologise to people if their own experience has been very difficult, and I have heard some of those stories, and thank you for your ongoing support, patience and kindness to staff who work across the health and care system. And I want to thank those colleagues for the extraordinary work that they're doing under a lot of pressure, and to thank them for pitching up every day, actually, because it would be understandable at times to think, oh, not again. We've got such strength in Powys in terms of our workforce, so I again feel hopeful that we can work together to move through what will be a challenging period. If I can move to the next slide, please. I just wanted to give a little bit of sense of how you, as individual patients or citizens, can help us to learn from your experiences. I had the pleasure of listening to some patient and family experiences recently, people that came and had a chat with me, and they are really important to us. We use them in a number of different ways, so we can use them in individual services to make improvements. We use them to know when we're doing things really well, to keep doing them. So good stories are useful, as well as those stories where we haven't managed to get it right this time. Importantly, they help us to keep improving the service and the experience that we give to people. So there is a website link there at the bottom of this slide. So it's pthb.nhs.wales/feedback-concerns. So please do get in touch with us. At the start of every public board meeting, we do have a patient story. So we use them to drive that innovation and that improvement. The next area that I wanted to touch on is one I can absolutely welcome our very new chair to the health board. I hope to hear from him in just a moment. But for those who have been used to having Professor Vivian Harpwood around our board table, each chair has a period of up to 8 years to serve in a public appointment, and Professor Hartwood's appointment has come to an end. I was absolutely delighted that through the public appointments process, a new chair has been appointed, and someone who is very familiar with us in Powys and in the health board. So delighted. I'm going to introduce Carl Cooper in just a moment to you. But just before I do, and I invite Carl to say a few words, some other new colleagues have joined us in the health board. So new independent members, Simon Wright from Cardiff University and Jennifer Owen Adams, who's representing the third sector as an independent member. And the picture of the person you see there next to Carl in the slide is our new Interim Director of Workforce and Organisational Development, Deborah Wood-Lawson. Deb has been with us for about a month, and soon to join us in January will be our new Director of Corporate Governance, Helen Bushell. But for now, let me just hand across to Carl Cooper. Diolch, Carl. I think you're muted, Carl. Are you muted?
There we are. Fell at the first hurdle, but I was just saying that I was I'm equally delighted to be here today, not just because I'm very excited about the new role and the work ahead. You know, it's going to be challenging, but equally, I think there's a lot to look forward to. I'm in role for just over 2 weeks, so very much climbing learning curves at the moment, getting to know who's who and what's what. Although, as Carol quite rightly said, I spent the last 14 plus years as Chief Officer of Powys Association of Voluntary Organisations, and so been working in Powys for many, many years and in very close partnership with the Health Board and the local authority and others. And so I come to this role with that experience, but also with that high respect and very, very high regard for the Health Board, its staff and all that it accomplishes for the people of Powys. Felly, dwi wrth y modd I fod yn y rôl yma. Dwi'n edrych ymlaen at y dyfodol efo cyffro ac efo positifrwydd, ac yn sicr wy'n edrych ymlaen at gydweithio efo cydweithwyr newydd o fewn y Bwrdd Iechyd. And perhaps the last thing I will say is that I'm being here is so important because we all know that engagement and involvement and good communication is so central. Legislation in Wales commits us, if nothing else, to delivering what matters for people. And it's sessions like this and initiatives like this that enable us to both communicate and also to listen to what matters to the people of Powys. And certainly I'll shut up now because I'm here certainly to listen and to learn. But diolch o galon, hyfryd I fod yma.
Oh, diolch, Carl. Thank you very much indeed. And we usually get posted some great questions from people who are tuning in, and then often we get questions afterwards when people are on, if you like, catch up on the briefing. So fantastic. Thank you very much indeed. If I move to the next slide, and this was I wanted to just share a little bit of a celebration really of the work that we have been doing as a health board on the Health and Care Academy. Now, we do that successfully only because of the partnership that we have with Powys County Council and with Powys Association of Voluntary Organisations, as Carl has just referenced. And it is the strength of partnership that means that we have been able to develop this Health and Care Academy here in Powys. The physical building is at the Bronllys Hospital site, and we have ambition to develop another hub site in North Powys associated with the North Powys Wellbeing Programme. But at the moment, even though there is not that building there in North Powys, people from North Powys, Mid Powys, South Powys can equally engage in learning for health and care careers. There's a couple of photographs there of the hub itself, and you can see in the top left photograph the Minister for Health and Social Care, Eluned Morgan, opening our hub, and the little white figure in front of the Minister is Pepper. Pepper is a robot, and you know, we're really trying to embrace the potential of digital and assistive technologies in our care and in our learning. The bottom left picture is a refurbished and a fantastic bungalow that we have on site, a simulation suite where we're able, that isn't a real patient in the bed, just in case you're wondering. It is a simulator and where we can train health and care staff, volunteers, carers to provide care to patients and for carers and to their loved ones, and feel confident in doing so. Now, the reason we felt this was important was because we really do want to be able to support local people in their training and education and in their career aspirations in health and care. At the moment, we've got apprenticeships around both health and care, but also then nursing, access to nursing qualifications, and you earn while you learn. A couple of briefings ago, we had a more detailed presentation on this, and even since then, the interest in undertaking courses or having experience with us as part of the Academy has grown. So I'm absolutely delighted that this is now well on its way and well established. As I said, we will be looking to do more work in this area. And if you're thinking about a career in health or care, and not just in the clinical care, because we have a very wide range of roles in administration, in finance, in estates, plumbers, painters, you name it, we've probably got a role close to it. Please do get in touch with us and see whether a role with the health board or with one of our partners is for you. So we'll come back to that, I've no doubt, at a future date. But for now, I'd like to just ask you to do a little bit of work, if that's okay. And we really do need your help. Carl just mentioned how central it is to us in Wales, and particularly in Powys, that we get to understand, to know, to appreciate what matters to you. So in terms of our work moving forward, with our colleagues in Powys County Council and in the voluntary and community sector, we're very keen to understand what your big ideas for Powys are. What are the big issues? I often touch on them in our briefings. We talk about workforce, we'll talk about emergency care, ambulance services. We'll talk about delays and challenges in accessing planned care, etc. But what are the big issues for yourselves? And please, will you share them with us? We are doing our wellbeing and population needs assessment, and then the plans moving forward. So we're asking that by the 13th of November, if you'd like to get in touch with us, please do have your say. And there's links there at the bottom of the page. And then a footnote, but a very important issue, is about stroke services. Wanted to take the opportunity to flag to you that there's an engagement consultation process started on potential changes to stroke services in Hereford. So if you live in mid Powys, this may be of particular interest to you. Please do, if you have an opportunity to have a look at that link there, that website, Hereford Stroke. That's the 11th of November. All of this information, as Adrian said earlier, is on our website. So please don't worry if you're trying to scribble this down. Your views really do matter, and they're important to us, that people are able to share their thoughts about what matters most. And then finally, the bit that is the question and answer, and an opportunity for anyone listening to ask questions of me, of myself, Carl, Adrian, and we will do our very best to answer as many as we can. For those that we don't get a chance to answer, or where it might be a bit more technical and I need some up-to-date information from a colleague, we'll look to follow that up and make sure we look to respond to your questions. So for now, diolch. Thank you very much indeed for listening, and I'm going to hand back to Adrian. And Adrian, see if there are any questions for us. Thank you.
Thanks very much, Carol, and thanks for those updates. So yes, the first question that I've had in, you touched in your presentation on the overall financial situation for the NHS for the whole country. So how challenging will it be to balance the books this year and next?
Oh, it's a great question. Thank you so much for that. How challenging will it be? It's going to be really hard. So if I just say that since 2015, the health board has broken even. So basically it hasn't overspent the allocation that it's been given by government. And that has been at times very challenging to do, and that success is down to the efforts of everyone in the health board and partners. But this year we're not going to be able to do it unless something really quite drastic changes. There is more detail in our board papers that we have published at the last meeting, but at the moment we are forecasting about £7.5 million overspent, and that's about that's on an expenditure of around £360 million. So there is something quite significant for us in terms of the challenges. So inflation is part of that for sure, but we've also got significant costs relating to additional workforce, trying to make sure we've got workforce that can cover gaps in staffing. We've also had increased costs around keeping people in hospital longer than they should be, and the challenges around community care provision. So very difficult this year, Adrian. We're looking at an overspend position. And now moving into next year, I mentioned the budget on the 17th of November. So it will probably hinge very much on that. But if I have a look at what the Scottish Government did yesterday, they actually have had to cut their investment in health services to manage some other costs. So I am actually working on the expectation that we will have reduced resources available to us next year. I've been in the NHS for 30 odd years, and I think we're about to enter probably the most difficult financial period of that time. It sounds very gloomy, but I do want to be upbeat as well, because we have managed really challenging periods like the pandemic. We have come together, we have found ways through. And so I have to be optimistic about how, again, we will rise to the challenge that will be reduced resources available to us.
Yeah, I think you referred to those financial challenges earlier. I think the Health Minister spoke last week of an additional £207 million bill for the Welsh NHS from energy bills alone from the impact this winter, and clearly that is going to have an impact on all of us. Now, you mentioned there about some of the staffing challenges as well, so that takes us handily into our next question, which is, what's the current position with Knighton Hospital?
Yeah. Well, thanks very much for the question. We have had really significant difficulty staffing Knighton, the ward in the hospital. So can I just be clear that it is the ward in the hospital at the moment that we've been struggling to staff. Other services are staffed. So the ward was temporarily closed during the pandemic, and we have been working really hard. And I want to thank people in Knighton and the district areas, because they've been engaging with us, really working with us to try to promote the area, and particularly to try to recruit registered nurses. Now, registered nurses are starting to get rarer than hen's teeth at this stage, so we know it's not an easy environment in which to recruit. And unfortunately, to date, we've not been particularly successful in attracting sufficient registered nurses to be able to reopen that ward. Now, I know that's very disappointing to many people, but we have to be able to operate wards safely. There is something called the Nurse Staffing Act in Wales, which talks about you must have safe numbers of staff on a ward to be able to operate it. But I've been encouraged by the conversations I've had with local people about what's important to them, and they say two things really. One is feels really important to have really good end of life or palliative care in the community area. So we've heard that. And the second thing that's really important is people want to see the increase in care. So whether that be in the community or step down facility. And I know we've got Cottage View there in Knighton, which is thriving actually. I visited it relatively recently, and if it was double the size, I think we'd still have people wanting to get into that facility. So we need to relook at what we can provide in a different way, I suspect. And that will be a feature that I know a number of health organisations across England and Wales are already having to do. So we're continuing to speak with people in the local community, and our commitment is to work this through with them over the next few months. So thanks. Can I just make a plug as well, though, for some of the other services in Knighton? There's some fab outpatient appointments going, brilliant therapy services, and where the maternity services, the birthing centre there, still offering a very personal and strong service. So last time I visited there, a vibrant community hospital, albeit the ward area closed.
Thank you, Carol. Now, my next question is actually for Carl, our new chair, and we've had a question come in asking, Carl, what are you most looking forward to in your role as chair of Powys Teaching Health Board?
Well, it's a small question that really demands a big answer, doesn't it? But I'll try and be very, very brief. It's always struck me that at its very, very basic, or at its fundamental level, good governance is about asking good questions. And the chair of the board, I think, is responsible for ensuring that the board asks good questions. And of course, linking to what we said earlier, we can only do that if we are sufficiently equipped and sufficiently informed, and the most crucial source of information is from people. And what I'm really looking forward to is getting out and about and meeting people and listening to people, so that we as a board can do our job of asking good questions. So that includes our staff, people who work within the NHS. It certainly includes patients and people and communities. So that energizes me, and to think that we can do that. Because what I'm also looking forward to, as Carol has quite rightly said, we are going into a very, very challenging time, and we can't minimise those challenges and pretend that they don't exist. But despite the challenges, I think there is an exciting opportunity to provide the best possible health services in Powys that are possible. And of course, increasingly, it's not just about providing services for people, but it's about providing services with people and with communities. And again, that excites me, working with people, working with communities to use the jargon, to co-produce, to find out together what the best possible looks like for Powys. And so that and a host of other things makes me very, very excited about the prospect of what this role and what the health board, together with the people of Powys, have got to look forward to.
Thank you, Carl, for that answer. I know as you say, it's a big answer for that kind of question, and I know in the health board as well, we're really delighted to have you on board as our successor to Professor Harpwood, and bringing your own experiences of social value community development in the third sector to all of those discussions around co-production. Now, back to Carol. We spoke earlier about Knighton Hospital. Our next question is, how's work progressing at Ysbyty Bro-Ddyfi in Machynlleth?
Oh, wow. Well, really, really well. Really well. And we are on track. And you know, this is a development that the people of Bronllys and the surrounding area have been waiting for a very long time. We had lots of hiccups and hurdles to overcome, and then when we got on site, off we went, and our contractor partners have been fantastic, and we're very close now to the end of that build, that redesign. We're expecting to have a handover of the building early in 2023, and then a couple of weeks before we are fully operational. But I want to thank local people in Bronllys actually for their commitment and support to the development. I know that there's been a lot of interaction with the team there on the site. The development of the gardens, the site does look very different, you know, but I was so pleased to have visited relatively recently, a few months ago, but then more recently had a look at the video film to see how much progress has been made. Now, just by way of reminder, the GP practice will move across and move into the building, and the building will act as a hub really for health and care and the community more broadly. And so I do hope people get an opportunity to come and have a little look as soon as we're able to invite people. So all's well. It was a significant investment, £15 million Welsh Government investment, and I like to think that demonstrates the commitment and the importance of health and care working together in rural Mid Wales. So that's brilliant. Thank you very much for asking the question around that.
And you mentioned there the video walkthrough. By coincidence, I just added that to our website this morning. So if people go to our Ddyfi page on our website, they can also have that great walkthrough to see the work so far. And actually, we've got the walkthroughs from previous months as well, which give a great opportunity to see the progress. Now, in terms of capital developments, I know one area that people are hopeful for is the development in Newtown as well, the multi-agency campus. So where are we up to with that, and what are the next steps?
Oh yeah, brilliant. So I was in Newtown yesterday, just a stone's throw from the campus area that we have identified. So where we are is the Welsh Government has approved our programme business case, which means that they're supportive at the highest level of the business case. We've then submitted something called the SOC. It is quite a long process, and SOC is a strategic outline case, and that is currently with Welsh Government, and we're trying to work through the mechanisms by which these big capital developments can get funded. Now, you know, we've talked quite a bit about money on this briefing this time, but we haven't, we're not imminently asking for the capital money or needing to draw that down. So we've got a bit more planning to do yet. So I'm certainly hoping that the financial challenges will come and go before we're ready to really pull down the capital requirements for that. But I just want to underline the level of commitment that I'm hearing about the development in Newtown for the people, for all of the people of North Powys, and being able to access more care in county does seem to be such an important issue for local people, and perhaps even more so now that, you know, cost of living and the fuel and all of that of travelling outside of the county becomes a bit more prohibitive. So we're going to be working really hard to get that campus up and running. There are some elements I'd like to see us doing earlier, so we're exploring that. It may be more in the temporary accommodation space rather than something permanent, but if we can bring more services closer to people in county, then that's what we're going to try to do. So Adrian, it's going pretty well. There's a few more hurdles for us to navigate, but I think the commitment is very strong.
Fantastic, thanks for that update. And just thinking about innovation and that ambition within the Health Board. You've talked about some of that organisational ambition there. I guess just as one last comment tonight before we close, wanted to give you the opportunity to talk about some of those individuals within the Health Board who've been doing wonderful things that are putting Powys on the national map for all the right reasons.
Well, absolutely, and a great opportunity for me to say thank you to everyone for their efforts and their innovations, but to draw out particularly a couple of people. So firstly, I would like to mention Jennifer Walsh. Jen is a nurse and is a nurse that actually looks after children and young people who have bladder and bowel issues. Now, that's often an area that people don't really want to talk about, and are a bit sort of reluctant to share when they have difficulties. But Jen's work is really sort of raising the flag to the need to come forward with those issues, and she works with families, with children, and their wider circle to try to improve the care for people with a bowel or bladder problem. And that work has been recognised by the Nursing Times, a very, very high standard to get an award from the Nursing Times. So Jen certainly is putting Powys on the map with her work. It's absolutely fantastic. I had the pleasure recently of attending the NHS Wales Awards, and sat next to, very proudly, Raphael Baptista. Raphael is a pharmacist in the Health Board, and he had been recognised for his work on developing a system of looking at medication and challenges with medication, whether it's the right dose at the right time and all of those things. He developed a system by which we can learn to improve the practice around prescribing and administration of medication, and that is a development that is now going to be used most likely right the way across Wales. So invented here in Powys by Raphael. That was fantastic. I'd like to mention a couple of other colleagues, Judith Jameson, Louise Heimers. They're both nurses here in Powys, senior nurses who, Judith works in the outpatients, and he's developing more and more outpatient type facilities and services for people to access locally, and she's been recognised for that work. And Louise for the work that she's been doing around palliative care, end of life, anticipatory care, encouraging us to have conversations about our wishes, but importantly involving families in care. So our Cariad scheme has been developed by Louise, and the Chief Nursing Officer earlier this year recognised Louise's work. And then finally, Claire Madsen, who's our Director of Therapies and Health Sciences, has been recognised for leadership, and really key recognition, because often leadership is quite challenging. You sometimes have to change things. Not everyone likes change. Claire's contribution to leading development and service change to make things better for patients is being recognised. So I think Claire's awards are coming up in 2 weeks' time, so we'll see how she gets on. But irrespective of winning or being a runner-up, this work in Powys has been recognised at a national level. So fantastic! Congratulations to everyone there who has had their work spotted and recognised in this way. Adrian, I recognise the time. We could be here all night sharing all sorts of fantastic work from our Health Board colleagues. Diolch to them all. Thank you all very much indeed. And thank you to people in our Powys communities for doing everything you do to try and stay well and to cooperate and uptake vaccination, etc. And I'm going to just finish where Adrian started about keeping well this winter, reminding you of all of the help and support that is available. Please do avail yourself of that. And We won't be back now until 2023 in our next briefing. So I do hope you take care of yourself, and we'll be back before we know it. So diolch yn fawr. Thank you very much to the team, as always, who put on the briefing, and very good night and best wishes to you all.